Podcasting from St. Louis, Missouri, this is Functional Wellness with Dr. Allison, your information and inspiration hub for all things health, wellness, and functional medicine. Your host, Dr. Alison DiBarto Goggin, has been practicing functional medicine for over 11 years. She is passionate about finding root causes and solutions for gut health, hormone balance, anxiety, and autoimmune conditions. Welcome to the show. Hello and welcome. If you are struggling with acne, breakouts, redness, cystic acne, and you don't know what to do, this video is for you. If we haven't met yet, I'm Dr. Alison DiBarto Goggin. I am a functional medicine physician and a doTERRA wellness advocate, and I help women overcome anxiety, gut issues, hormone imbalances so they can feel like themselves again. So let's dive into today's topic, which is acne. So acne happens because our oils and dirt block our hair follicles, and then we have these breakouts. Now, there's a lot of reasons in functional medicine why we can have acne on our skin, and we're going to dive into those. But my main favorite place to start is actually with traditional Chinese medicine face mapping. And this is because we can tell a lot by what's going on with the phase of what's being done in the body. So our organs are actually reflected out in our skin through different parts of our body. So places like the forehead actually relate to the small intestines, and the lower chin is related to the kidney and bladder. So it's really important to understand where on your face you're having breakouts so you can understand how to better treat and support your skin. Now, to just very quickly start, I like to spot treat the skin with certain essential oils, diluted of course, so you're not overwhelming your skin. The first thing that of course you want to do is wash your hands, because clean hands on a clean face is very important to stop the cycle of acne as well. So I like to take a bottle of tea tree oil and just dab a little bit on the spots that are having an issue. I also like to use frankincense or Correctex, which is their skin support gel. It is fantastic for clearing, especially if you're dealing with scarring or long-term issues. Of course, you want to wash your skin in the morning and in the evening as well. You have to get off your makeup, you have to get off the day, and you need to make sure that you're taking care of your face and your skin in the morning. The biggest issue that I see most people doing is that they're using really harsh cleaners for their skin, where after you wash your skin, it feels nice and tight and you feel like, ooh, I did something good. But actually that tightness is dryness. And then your skin will respond by creating more oil. So we really create this vicious cycle where you dry your skin out too much, it overcompensates and creates too much oil. And then you're trying to get all this oil and acne off of your face by drying it out even more, which creates more oil, and then it's a really hard cycle to break. So after you wash your face needs to feel light and clean, but not dry. It should still have some moisture and balance to it. That's why I love using doTERRA's essential oil skincare. They also have a line called HD Clear, which is specifically made for acne. It works great for teenage skin. I find that for people who are older, sometimes it's not as effective because their acne is coming from somewhere else. And on that note, we want to make sure that the makeup that you're using is clean and clear, one from a toxin perspective. So I like to go to the Environmental Working Group, ewg.org, to check the makeup that you're using, because your skin just might be sensitive to the chemicals that are in there and causing you to break out. Of course, makeup is going to close down your pores so your skin won't be able to breathe. It might be trapping more dirt on your face as well. So you have to be really careful with the type of makeup that you're using. You also have to clean out your brushes, your sponges, your blenders, all of those things on a regular basis, because they're picking up oil and dirt from your hands and then they're putting it all over your face wherever you leave it. So maybe you're putting it in your makeup drawer or it's on your counter and everybody's touching it if you have kids at home. So you need to make sure that you're washing them consistently and also replacing them consistently to decrease the amount of bacteria, oil, and excess makeup that would be on them as well. Now, most people don't want to hear this because it might be the hardest part, but acne is closely related to food. Our skin is very responsive to foods that we are sensitive to. The main foods that I have my patients stop eating is gluten, dairy, caffeine, and chocolate. Those are the main offenders. And once you get that out of your diet and out of your system, your skin tends to clear up more quickly. Processed foods is also an issue, so fast food. It's not necessarily the fatty foods, but like greasy foods and highly processed foods with MSG, excess sugar, soda, coffee, things like that can really contribute to acne. And once you get that out of your system, it will calm down the inflammation and your skin won't be so responsive to that. A quick note, the skin is our detox organ, right? So it's drastically affected by our gut, our lungs, our kidneys, and how our body clears out the things that it uses. So our metabolites, our hormones, and our food. So exercise is actually a great way to help improve your skin as well because you're moving your lymphatics, you're getting fresh air in and out of your lungs, you're getting your gut moving. So walking, stretching, abdominal massage is also a great tool to help support your skin. I do like to supplement, so I like to use doTERRA's Lifelong Vitality Kit because it has those E omegas in there as well. But essential fatty acids are really, really important because they calm down inflammation, so it will help support your skin, reduce redness as well. It helps support hormones, so if you have any hormonal acne issues, it will help clear that up as well. Our skin is made of fatty acids. Actually, all of our cells are made from fat and cholesterol. So healthy fats in the diet are really important, but also healthy fats from a supplementation point can support the skin, reduce scarring, support quicker healing, and also reduce how many times you have a breakout. I do like to do nutritional evaluations. Zinc and vitamin D tend to be one of the biggest contributors to acne, so you actually need more zinc and more vitamin D to help those as well. I like to use a product from MediHerb called Dermaco because it has a number of herbs to help keep the blood clean, keep the skin clean, and improve healing of the skin as well. Now, if you have cystic acne where it gets very large, or if you have cystic areas otherwise in your body, that's typically a hormone concern. So we need to definitely do some testing to make sure that your hormones are in check before we start any type of protocols. I would say that for the past 15 years that I've been doing saliva testing on my patients for hormones, we started with saying everybody has estrogen dominance, everybody needs to do a detox. And I've actually found that many people have the same symptoms, but their hormone panels actually look very different. For someone who has PCOS, we would assume that your testosterone would be through the roof, and that's what we need to get down. But I've actually found many women with PCOS whose testosterone is very low and imbalanced. So make sure you do some testing first to figure out exactly where your hormones are before you start taking any supplements that would impact how they work. I like to use saliva or the Dutch urine test. They're both very easy to do at home, and then you send it into the lab, you get results very quickly, and then you know exactly what to do to help support your skin and your hormones at the same time. I know that acne is very, very frustrating and very difficult to treat many times. So my suggestion for you would be to stop looking directly at your skin to try and treat it that way and treating it directly, and start looking at what else is going on inside the body. Get your blood work done, make sure your thyroid looks good, check your vitamin D levels, what are your vitamin B levels, make sure that your liver levels are doing well, and your inflammation levels are in check. And then start diving into deeper of what other symptoms do you have? Where else do you have pain, or is there something else going on in your body? And when you clear that up, then your skin will clear up. So it's a multi-step part of your healing journey. And this month in July of 2021, we are doing a skin, hair, and nails educational series. So this will be on our podcast. I have it going on daily in my free functional medicine group on Facebook. So I'll put the links in there below. If you're watching after, don't worry. Everything will be there for you to join as well. So thank you so much for tuning in. Make sure you like and subscribe so you stay tuned with all of our weekly videos. And if you're looking for personalized care, you want your blood work done, you want to get those tests done, I always offer a free health assessment for you. So we can chat for about 30 minutes, talk about your goals, your concerns, and your symptoms, and brainstorm on a plan for you to move forward. Thanks for tuning in, and we'll see you next time. Thank you for listening to Functional Wellness with Dr. Alison. If you would like personalized care and testing, you can schedule a free introductory consult with Dr. Alison online at Little Black Bag Medicine, or message us on Facebook at Little Black Bag Medicine. Thanks for tuning in, and we'll see you next week.